For this video, I'm going over the term 3 final drugs. So I'll say the name of the drug first to see if you can test yourself, and then I'll go into it. I'm going to talk about the classification and the use. And just remember that some of the drugs have multiple classifications, so it's always good to learn them both ways. Cogentin. It is an anticholinergic and an anti-Parkinson's agent. So it's used to treat Parkinson's. This is the drug that's going to help with the tremors and the drooling because it's going to help dry it up. Next is prednisone. It is a corticosteroid and it reduces inflammation. You want to remember to monitor blood glucose, monitor for Cushing's, and monitor for infection and long-term use. Vistaril. It is an antihistamine. It is an antipyretic. Its use is for emotional or psychoneurotic states characterized by anxiety, tension, or psychomotor agitation. It relieves anxiety. It controls nausea and emesis and reduces narcotic requirements before or after surgery or delivery. So it's also used in management of pruritus due to allergic reactions. So this is one of those drugs that it has different meanings. It can be an antihistamine and it can also be used for psychosis. Lithium. Lithium is your psychotherapeutic agent. It is a mood stabilizer. It's used to treat depression, and the therapeutic range to remember is 0.5 to 1.5. Sinemet. This is an anticholinergic. It's an anti-Parkinson's agent, so it's used to treat Parkinson's. Synthroid. It is a thyroid agent. It's used to treat hypothyroidism. Dilantin. Dilantin is an anticonvulsant. It's also classified as Haldol. It's used to treat seizures, and you want to remember the therapeutic range is 10 to 20. Avert. It's an antihistamine. It's also an antivertigo agent. It's used to treat nausea, vomiting, and dizziness. Paxil. It is a psychotherapeutic agent, an antidepressant, and an SSRI. It's used to treat depression and OCD. Aricept. It is a cholinesterase inhibitor. It is used for mild to moderate dementia. And for this one, you want to remember that you're monitoring for bradycardia or for diarrhea. Flomax. It is an alpha adrenergic antagonist, and it's used to treat BPH. Diabetic. It is an anti-diabetic agent. It's used for type 2 diabetes. Digipan. It is an anticholinergic, antispasmodic. Its use is for overactive bladder, and it treats bladder spasms. Metformin. It is an anti-diabetic agent, and it's used for type 2 diabetes. Narcan. It is an opiate antagonist, and it's used for drug overdose. Luvox. It is a psychotherapeutic agent. It's also in SSRI. Its use is depression and OCD. Nardil. It is an antidepressant. It is a MAO inhibitor. Its use is depression, not responsive to more commonly used therapy. Pilotcar. It is a miotic. It's an anti-glaucoma agent. Its use is for open and closed angle glaucoma. Procrit. It's a blood former, coagulator, and anticoagulant. It's a hematopoietic growth factor. They use it for patients with anemia. Tapazole. This is your antithyroid agent. It treats hyperthyroidism. Haldol. It is a psychotherapeutic antipsychotic. Its use is for psychotic disorders, and it also has an antiemetic effect. Wellbutrin. It is an antidepressant. Its use is for depression. Timoptic. This is a beta adrenergic antagonist. It's also a miotic. Its use is to reduce IOP and open angle glaucoma. Disulfiram. This is an enzyme inhibitor. It's an anti-alcohol agent. Its use is to help alcoholics who want to maintain sobriety. Namenda. It is a NMDA, which is your N-methyl D-aspartate receptor antagonist. Its use is moderate to severe Alzheimer's disease. Proscar. It is a synthetic substitute. It is an anti-androgen. Its use is for BPH. Clozaril. It is a psychotherapeutic agent. It's an antipsychotic. Its use is to treat schizophrenia. PTU. It is an antithyroid agent. It treats hyperthyroidism. Lovastatin. It is a lipid-lowering agent. Its use is to treat high cholesterol. Good luck!